Many parents have questions about the autism diagnosis and what it means. Autism spectrum disorder, or ASD, is characterized by social interaction difficulties, communication challenges, and a tendency to engage in repetitive behaviors. However, symptoms and their severity vary widely across these three core areas. Taken together, they may result in relatively mild challenges for someone on the high-functioning end of autism spectrum. For others, symptoms may be more severe, as when repetitive behaviors and lack of spoken language interfere with everyday life. Now, while autism is usually a lifelong condition, all children and adults benefit from interventions or therapies that can reduce symptoms and increase skills and abilities. Although it is best to begin intervention as soon as possible, the benefits of therapy can continue throughout life. The following are guidelines to help parents know how the diagnosis is reached and what it means. Now, a team of professionals, with the pediatrician leading the team, is required to reach an autism diagnosis. The team approach is unique to autism. Now, the team may include school psychologists, counselors, parents, teachers, speech pathologists, occupational therapists, etc. Now, parents work with the pediatrician, and they will know how to evaluate needs and create the team. Now, autism exists on a spectrum, so children with this diagnosis will not behave or demonstrate the exact same behaviors. There is ongoing research, and the terminology is constantly changing. Terms like Asperger's and PDD-NOS are outdated terms that have been replaced in the newer editions of the diagnostic manuals used by professionals. Be aware and understand that changes may continue to occur as autism research continues. Research has shown that vaccinations do not cause autism. Currently, there are no known causes of autism. Now, once the autism diagnosis is confirmed, you can begin to learn new strategies and treatments. The recommendations for treatment will vary depending on your child, their age, their specific manifestations, and their behaviors. However, it is recommended that parents seek out a physician well versed in treating autism and who operates under the medical home model. Parents will always be an important part of treatment. The important thing to remember is to remain calm. Becoming too emotional will cloud your reactions, and it may be more difficult to teach your child. Now, seek out the help of professionals who can assist in raising a happy and resilient child. Begin researching various techniques based on your child's needs. Make a list of how autism is manifested in your child. You can begin by researching specific approaches to dealing with that type of behavior. Now, the skills on smarter parenting are also helpful. In any interaction with your child, you will use preventive teaching and corrective teaching, as well as all the other skills that are there. You can see how to apply these skills in the Behavior Skills tab on this page.